Hello, everyone, and welcome to Mountain Lake Journal. I'm Tom Halleck. This week, millions of dollars in funding for seniors across the state for services like home-delivered meals and in-home care are on the chopping block in Governor Hochul's budget. North Country Assemblyman Billy Jones spoke out against those cuts at a joint legislative budget hearing in Albany in late January.
I see we have less money in our Office of the Aging budget than we did last year. 9.3 million ad is gone. I see other funds down. We're talking about that non-Medicaid eligible list. All right. I hate to talk about return on investment when we're talking about our veterans, our loved ones, our neighbors, our family members. But unfortunately, this is one of the few areas we have to talk about in human services. We have to talk about return on investment. When we're talking about our neighbors, our loved ones, our veterans, we have to talk about it because we're so severely underfunded every year.
Assemblyman Jones and other advocates say many of the services help seniors age in their own homes instead of needing assisted living or skilled nursing care that can cost the state significantly more in the long run.
We're trying to keep people in their homes, aging in their communities. And we all know that for that investment, that'll help us out in the long run because it's much more expensive to to have people reside in assisted living and in nursing homes. So we just need a bigger investment for those unmet needs, those non-Medicaid people, and it allows them to be in their homes, allows them to be in their communities, allows them to be near their loved ones and their family members. It is a simple thing, and every year we fight. It's not a simple thing, but every year we fight to get a little more funding put in there, and in the long run, we know that it is a good investment.
We caught up with the Assemblyman at the Minor Farm, where he was helping the United Way raise money to fight homelessness. More on that in just a few minutes. And Becky Preve, who is the Executive Director of the Association on Aging in New York, joins us now. Welcome. It's nice to have you back.
Thanks for having me.
We are in that time of year. The joint legislative hearings on Governor Hochul's proposed 2025 budget are underway, and a hearing on human services was held a few weeks ago, and that includes funding for many of the senior programs and community-based services in New York State. When you last joined us a few months ago, you mentioned that many people were hopeful they would see increases in this year's budget to help care for the growing number of seniors in New York. More funding for community health care, home-delivered meals, home health aides. Was the funding not what you had hoped that it would be?
Unfortunately, not only did we not receive any increases in funding for those types of services, we actually were hit with a significant decrease in funding for the essential core programs that we provide. So to put that kind of in context, the advocacy community, aging community fought really, really hard to get increases in last year's proposed budget because we have people that are waiting for services in the state of New York today. So we were able to secure an additional $9.3 million in last year's budget from the Assembly edition and $2.5 million for the long-term care ombudsman program, which protects the rights of nursing home residents across the state. Unfortunately, the governor's proposed executive budget cuts that $9.3 million for home care, transportation, home-delivered meals, and the $2.5 additional for the long-term care ombudsman program. And what that means, Tom, is that we have people that we turn services on for that they now are dependent upon. And those could be anything from a home-delivered meal to transportation to chemotherapy or dialysis. Without that $9.3 million, we're going to have to cut those services. In addition, the long-term care ombudsman program, which finally had some additional staffing to try and meet some of the national standards, that was staff dollars that was used to hire ombudsmen and recruit volunteers. Without that funding, we're going to have to cut that program yet again. And that is something that, as we go through the master plan on aging process, we really wanted to be thoughtful about the fact that we do have a growing older population. We do have a population with needs, and we need to adjust revenues to be able to support those individuals.
I think a lot of people thought when Governor Hochul announced that the state was embarking on a state master plan for aging, as you just mentioned, holding the public hearings around the state to gather input on how to design a plan with the goal of ensuring that older adults can live in their homes instead of going to assisted living or to nursing homes, that the state would follow through with funding to pay for those types of programs. You've made the point numerous times that those programs are far less expensive in the long run than having folks go to assisted living or nursing care facilities and having the state have to kick in Medicaid funding.
Absolutely, and when you look at the New York State budget, there is a concern about the growing Medicaid budget, right? That's something we don't think we can sustain long term. So really, when you look at what services are provided through local offices for the aging, we predominantly serve non-Medicaid eligible individuals. And when I say non-Medicaid, it means they're above the income benchmark for the low-income Medicaid program, but they can't afford to privately pay for the service. Those are retirees that were the heroes, that were teachers, that were healthcare workers. We're able to subsidize services for those individuals in homes and communities. We know from looking at our own data in the state of New York that our typical or average client, if you looked statewide across our core programs, is in their 80s, they're lower income, they have 4 to 10 chronic conditions like diabetes, congestive heart failure, and they need assistance with activities like taking a shower, making a meal, or cleaning their homes. If you looked at that individual from a statutory standpoint, they would qualify to go to an assisted living or a skilled nursing facility, and in order for payments for those facilities, they would impoverish themselves down to Medicaid. And then the cost of skilled nursing facility placement is between $140,000 and $150,000 per year. We serve the same client in their homes and communities for less than $10,000 per year on average for 6.5 years. So if you're looking at this long-term Medicaid issue and the population growth in those over the age of 60, we know that if we can serve them at home for less than $10,000 per year, we're going to save hundreds of millions of dollars to the Medicaid system in the long run and really prevent that expenditure to the Medicaid system.
There are waiting lists for many of those programs because they're popular and people would like to take advantage of them. The hope was that there would be funding in the budget this year to maybe help cut into those waiting lists, but that may not be
there
the
wasn't, and we're actually going to increase our waiting list due to the reductions that we received from last year's budget. And those are services that are life-sustaining services. So a home-delivered meal is not just a meal, it's a daily health and safety check. It's the reason some people are able to be discharged from acute care facilities because they know they're going to be checked on a daily basis, all the way up through our home care services program, which literally allows people to live independently in their own homes. We have 18,000 services that are waitlisted in the state of New York today. We anticipate seeing that grow just based on population density.
Were lawmakers sympathetic during the budget hearing, and is there any hope that they may push for more funding when the budget negotiations begin between the governor's office and both branches?
Absolutely. So we're working really closely with Senate and Assembly members, not only on the aging side of the House, but also in health. Because again, when you look at all the networks that support older people, it's not just the offices for the aging. It is skilled nursing facilities, it is hospital systems, and more specifically, it's about home care services. And when you look at the proposed executive budget, there are cuts to that entire ecosystem. So we're really trying to make sure that elected officials who get calls from constituents every day, that they're really supporting additional funding for these core programs and services, because absent the services, people either are left to languish and die on a waiting list without receiving a service, or they're forced into institutional care.
And the skilled nursing facilities, Medicaid costs, is state boosting those, or are there cuts there as well?
There are cuts there as well. They are cuts to almost all skilled nursing facilities. There are massive cuts to the home care services program. And so the ripple effect to cuts to nursing homes and cuts to home care services push additional customers to our service infrastructure where we already have a waiting list for those core programs and services.
Becky Preve, thank you very much for taking the time to come and talk with us.
Thank you.
We appreciate it.